The presenting author is Dr. Kajal Pal. I'm sorry about that.
Good afternoon, respected judges. My presentation topic is Atoll sign in posterior lenticonus. Introduction. Posterior lenticonus is a rare progressive disease characterized by protrusion of posterior lens capsule along with the lens cortex into the vitreous cavity. It may be associated with local thinning or absence of the posterior lens capsule. So chief complaints of the patient presented to us was a 22-year-old male with complaints of diminution of vision in both eyes. Left eye was more than right eye since childhood, but it was worsened more since last 6 months. Visual acuity in right eye was finger count at 2 meters, which improved with to 5/60 with pinhole, and in left eye it was 2/60 with no improvement with pinhole. On retinoscopy, scissoring reflex was observed in his right eye. Intraocular pressure in right and left eye was within normal limits. This is a slit lamp showing posterior lenticonus and intact posterior capsule in the right eye, and the other figure is showing the left eye showing advanced cataractous changes with a collapsed posterior cone. This is ultrasound biomicroscopy of the right eye, which is showing posterior cone with subcapsular cataractous changes, and the left eye showing advanced cataractous changes with a collapsed cone. So these are the examination findings. The adnexa conjunctiva were within normal limits of the both eyes. Both eye corneas were clear. Pupil of both eyes were normal in shape and normal in reaction. Lens of the right eye showed posterior lenticonus with cataractous changes, and left eye showed posterior lenticonus with advanced cataractous changes with collapsed cone. Fundus was normal in both eyes. Management. Patient was operated on right eye with in right eye with phacoemulsification and 3-piece IOL placement in the bag with uneventful outcome. And left eye was operated 1 month later with single-piece foldable IOL placed in sulcus. Outcome. So best corrected visual acuity in right eye was 6/6 and in left eye was 6/24, which was most probably due to amblyopia. Discussion. The lens is surrounded by a lens capsule, which is a basal membrane secreted by the capsular epithelial cells and is mainly composed of type 4 collagen. Lenticonus is localized bulging of the lens capsule, which can reach the diameter of 2 to 7 mm. On a slit lamp, it is characterized by transparent, localized, sharply demarcated conical projection of lens capsule and cortex, usually in axial section. In early stages, retroillumination shows an all-drop configuration. Advanced stages, it is associated with subcapsular and cortical opacities. Pathogenesis of posterior lenticonus remains elusive, but various hypotheses are given like rupture of posterior lens capsule, hyaloid artery retraction or trauma, congenital weakness of posterior capsule, or aberrant hyperplasia of the subcapsular epithelium, etc. In bilateral cases, genetically determined congenital weakness of the posterior lens capsule is likely, which is usually X-linked and autosomal dominant. The presentation may be varied from asymptomatic to complex astigmatism leading to amblyopia and strabismus. All patients develop cataractous changes with time at the level of the lenticonus, which can spread to the adjacent subcapsular cortex. Posterior lenticonus is reported to be associated with other ocular and systemic congenital anomalies like nuance retraction, retinal pigment epithelial lens colomas, anterior chamber angle anomalies, axial myopia, morning glory syndrome, whereas Alport down and Loeys syndrome are reported systemic associations. A new MPPC syndrome having bilateral microcornea, posterior megalolenticonus, persistent fetal vasculature and chorioretinal colomas have also been described. Diagnosis is mainly clinical but can be difficult in asymptomatic patients. In oil droplet sign and fishtail sign can be seen as described as seen here in the figure. We are proposing an Atoll sign in advanced cases of posterior lenticonus with intact posterior capsule on slit lamp examination. Positive Atoll sign is more favorable prognosis since posterior capsule is intact. Hence, posterior chamber intraocular lens implantation will be more feasible with better visual prognosis. Atolls are annular mid-ocean geographic formulations which are water body lagoons surrounded by rocks, sand and gravel. Similarly, advanced posterior lenticonus with intact posterior capsule, which appears like atoll, with the central posterior cone, which is clear, appears laguna surrounded by the lens material showing cataractous changes. The term atoll is derived from a Maldivian, the way we chose word atoll. Thank you.
First of all, you have only one case. You've
Yes,
shown
ma'am.
only one case. Ideally, this should have gone as a poster instead of a free paper, but that's not your fault. So, it's fine. It's an interesting case that you have chosen, and the sign that you have showed is also good. So,
Just tell me what exactly the atoll sign is. It the slit lamp view? It is the ultrasound, the OCT anti-second OCT view, ultrasound view. You know the oil droplet. You can see also in the retinoscope.
Yes.
So what exactly the atoll sign?
Atoll sign can be seen on the slit lamp, sir. On the slit lamp, when you do slit lamp microscopy, then you can see the atoll sign. And advanced cases, you can see atoll sign. In the early stages, you can see oil droplet reflexes.
But whether you land up with complications or not, that doesn't depend on the atoll site itself. You need to know with the ultrasound or anterior segment OCT whether there is a dehiscence in the posterior capsule or not. So just seeing the atoll sign, it doesn't really mean much for you, for your management.
So that was what our studies like. If there is a positive atoll sign, this means that the posterior capsule is intact. So we can place a
Have you
posterior
compared
chamber.
that whether you felt it is a atoll sign and then did the anterior segment OCT to check the dehiscence of the posterior capsule?
So
Whether
we
the-
did. So we
it
did
is
the
directly
ultrasound
linked?
biomicroscopy in which we could see that the posterior capsule was intact.